Assalamualaikum warahmatullahi ta'ala wabarakatuhu. A pleasant day to each and everyone. So, una sa lahat, pasensya na for the very late upload ko ng mga lectures regarding sa ating nutrition. Okay, so I've been busy for few weeks. That's why I wasn't able to upload a lecture video. But, ano to? Malapit naman din natin matapos itong subject na to. So, today we will continue our discussion for chapter 9, okay, the pregnancy and lactation. And then, ang natitira na lang kasi is the chapter 9, 10, 11, 12, 13, 14, 15, 16, 17, and 17. So, hanggang 17 tayo. Pag umabot ako ng mga adolescents, for after ko ma-discuss yung childhood for the chapter 11, chapter 12 hanggang 17 will be assigned as a reporting. So, the reports will be posted, okay? And then afterwards, tsaka tayo mag-exam, okay? So, tapusin muna natin yung lecture lahat and then tsaka tayo mag-exam. And also, I will schedule your food exhibit by May. So, inshallah, siguro mga after Eid al-Fitr, tsaka tayo mag-schedule para at least mas maganda yung ating food exhibit. So, the theme for our food exhibit will be therapeutic diets. Okay? So, later on, madidiscuss natin ano ba yung mga iba't ibang therapeutic diets and yung groupings pala is ibibigay ko lang din sooner or later. Okay? So, please be patient and inshallah, matatapos din natin to sa madaling panahon. Okay, so let's start with the chapter 9, pregnancy. So pregnancy or gestation is the period when fertilized ovum implants itself in the uterus. Okay, so it undergoes differentiation and grows until it can support extrauterine life. Human pregnancy can last for a period of 266 or 280. That's 280. Okay, 266 to 280 days or umaabot ng 37 to 40 weeks or in months, 9 months. Okay? So, it consists of 3 trimesters. So, we have the first trimester, pag sabihin natin trimester, 3 months. Okay, first 3 months, second 3 months, third 3 months. So which correspond to the 3 main phases: the implantation, the organogenesis, and the growth of the fetus. So yun yung ating pregnancy. So bakit ba kailangan nating pag-aralan? Bakit sinasama yung pregnancy sa nutrition? Remember that during pregnancy, you're supporting a life, okay, in the uterus. So, kailangan mabuhay yung baby, kailangan mabuhay yung fetus. So, in order to support the life of the fetus, kailangan maganda yung nutrition natin. We need to have a good health, and including to have a good health is to have a well-balanced diet, okay? Ano mga instances sa sumaugat na may mga times na during first trimester, ayaw nilang kumain, or during second trimester, sobrang takaw na kumain. May mga specific kasi, or may allotted na weight gain sa ating, mothers, during pregnancy. Kasi pag nasobrahan yung ating weight gain during pregnancy, ang tendency is malaki yung baby na mailalabas mo. And which is not good kasi hindi siya magpropromote ng normal delivery. Darating sa point na malibad na cesarean delivery instead of normal delivery. It's because malaki masyado yung baby. Okay? So, during may mga biological changes tayo in pregnancy. So during the implantation, that will be on first 2 weeks, okay? Period of organ formation the next 6 weeks, and then for period of rapid fetal development is remaining 7 months, okay? Sa kamubawata, mas mabuti na yung 7 months na preterm kaysa sa 8 months. Bakit? Ma'am, bakit? Kasi sa 7 months, hindi pa masyadong nagsastart yung lung development. While as sa 8 months kasi, nag-start na siya. And once lumabas siya, na-halt mo kalagitnaan yung pag-develop ng kanyang lungs. In which, yun na nga, mas madakal so risk apkakwa wata gilalagi dito ining bawata at 8 months. Okay, so nutrition in pregnancy. During the total pregnancy period, the basal metabolic rate increases from 6 to 14%. So, tumataas yung ating basal metabolic uh, metabolic rate. So, BMR natin. So, I think, na-discuss na natin kung sino si BMR. Sana hindi nyo nakalimutan. So, the calorie intake is increased 10% to 20%, which is 2,700 to 3,000 per day. Yun yung calorie intake natin. So, if the woman is overweight, it is necessary for her to reduce. So, during the course of pregnancy, the total energy cost of storage plus maintenance or additional work, kasi may additional work for maternal heart and uterus and a steady and basal metabolism, which amounts approximately 80,000 kilocalories. So the energy cost of pregnancy then is about 300 kilocalorie per day. So the energy intake should be 36 kilocalorie per kilogram of the pregnant weight per day. So example lang natin 36 'di ba per kilogram. So ang weight ng patient mo is nasa nasa 50 kilograms yung inyong patient. So, nasabi dito that the energy intake should be 36 kilocalories per kilogram. So, nasa 50 kilogram siya. Ita-times natin siya sa 36. So, nasa 1,800 kilocalories dapat yung nakukuha ng pregnant na yon per day. And as mag-increase yung weight gain ng ating patient, nag-increase din siya. So, recommended protein intake for women, okay, requires additional 9.5 grams per day or a total of 900 to 950 grams for 9 months gestation period. Okay, so what will be the reason? Okay, what are the reasons for additional protein? So first is to provide for the storage of nitrogen. Next is to protect the mother against many complications of the pregnancy. Next is for the growth of the woman's uterus, placenta, and associated tissues. Kasi hindi lang bata yung lumalaki sa tiyan ng mother I mean the uterus. Okay, the uterus itself, may mga placenta dyan, and other tissues para for the good nourishment of the baby. So to meet the needs for the fetal growth and repair, for the growth of the mammary tissues, okay, nasa breast area natin yan siya, okay, para mag-promote ng lactation, and for the hormonal preparation for lactation. So, yun yung mga reasons bakit numadagdag tayo ng protein intake sa ating mga pregnant woman. So, if you take a look into in our books, okay, may kita dito yung mga tables in which masasabi or nakalagay dito yung maternal weight gain, recommended weight gain, protein allowances, calcium allowances, calorie allowances, iron allowances, iodine, vitamin, and food allowances. So, I think it would be better if you will read those para mas makita ninyo kasi mas maganda, naka-table kasi siya. So, mas ma-appreciate niya siya. Okay, so for the calcium, phosphorus, and vitamin D, this would be increased kasi it is needed to calcify the fetal bones and teeth. Huwag nga lang sobra. In case naman na yung patient, okay, the pregnant woman nag-undergo or nakaranas ng hypercalcemia, ang tendency is yung kanyang bata, pag ilabas is nagkakaroon na ng teeth. Yes, that's possible, okay? Pag-increase talaga yung calcium sa blood ng ating mother, nangyayari is increase din yung calcium sa blood nung nagsisirculate na calcium sa blood ng baby. That's why nagkaroon siya ng baby teeth. Okay, teeth. Okay, so for the iron, at least 700 to 1,000 of iron must be absorbed and utilized by the mother throughout her pregnancy. Bakit kailangan ng iron? 'Di ba? Kailangan i-prepare natin yung ating mother for the maternal bleeding. Okay? During delivery kasi, malaki yung amount ng blood na nawawala sa kanya. Nasa 500 ml to 1,000 ml or 1 liter. Pwedeng umabot pa ng 3 liters. Pag cesarean cases, umaabot na pag sobra yung maximum bleeding na siya, nagma-max out, maabot ng 1.5 to 2 liters. So, in ganon, in cases na para para ma-prevent natin yung hemorrhage and ini-increase natin yung ating iron intake. Kasi, associated mamugira during pregnancy, nagkakaroon ng iron deficiency anemia yung mga mother kadalasan. Okay, for the iodine, this is to help the mother and the child prevent goiter in the future and for the brain development, which is the regular use of iodized salt. Bakit kailangan nga si iodine? It is for the development of the brain of the child. Okay? Alam naman natin that iodine is very important in regulating hormones in our body. And these hormones are have certain factors or certain effects in our body in order for us to maintain the regulation or the normal regulation ng ating katawan. Okay, next is for the folic acid. Women of childbearing age consume 400 milligram of folic each day. Bakit nagtitake ng folic acid yung ating mga mother? This is for the, for the development of the spine and the brain, okay? At ng mga tendencies, yung bata is pinanganak na walang brain, okay? Or may defects sa kanyang may spinal defects. Ang isa sa mga factors bakit nag-cause yun is low intake of folic acid or konti lang yung folic acid sa katawan ng mother. That's why hindi nabigyan ng enough folic acid yung ating baby. Okay? So, for the vitamin allowances, for vitamin B1, it should be increased. Okay? Hindi ko nasasabing kung sino pa si B1, B2 because we have already discussed it. Okay? Vitamin B2 should be increased. Vitamin B3 should be increased. And vitamin A, lahat to siya, ito yung mga important na increase natin. So, vitamin A is important in the epithelial tissues or epithelial cells during organogenesis, and it is needed to ensure good vision of the fetus, okay, for the development of the eye or the sense of vision. For folic acid and vitamin B6, it is important for the synthesis of the RBC. Okay? So, for the weight gain, so, the recommended weight gain, okay, for the, pregnant woman. Okay, so dito yung ating pre-pregnancy weight and recommended weight gain. So, dito, the components of maternal weight gain is shown dito sa ating, sa table 50 on page 198. Okay? So, the weight of the blood volume and the enlargement of the reproductive organs are fairly constant. If the weight gain is less than the weight of the maternal components in pregnancy, the growth of the fetus calls on the reserve of the mother. Although weight gain varies, it is generally agreed that the normal curve of weight gain is sigmoid in shape. A small weight gain is observed during the first trimester. A more rapid weight gain happens in the second trimester, and a slower weight gain it is recorded during third trimester. An average, okay, dito may nyo ang bagi-bagi si underweight, si healthy weight, okay, or normal weight, overweight, or obese. In tendency or in cases na underweight yung ating patient, you need to take the BMI ha, para masabi natin na this is the recommended. Again, before natin masabi na ito yung recommended weight gain mo, we need to take the BMI, okay, or the body mass index, okay? So, alam niyo na siguro yung formula with that. So, underweight, okay, nasa below 18.5, ang recommended weight gain sa kanila during the pregnancy is nasa 28 to 40 pounds. Okay, for the healthy, nasa normal, nasa 18.5 to 24.9, nasa 25 to 35 pounds. Okay, for the overweight, nasa 15 to 25 pounds lang yung kailangan nilang mag-gain na weight all throughout the pregnancy. And for the obese, nasa 15 pounds lang. So, hindi pwedeng sumobra o kumonte lang. Again, pag konti lang yung ating weight gain, hindi siya masyado nakakatulong sa fetal growth, okay? Dapat maintain na nasa normal range ng weight gain yung ating nangyayari sa ating patient, okay? So, dangerous for pregnant woman. Ano ba yung mga masasamang mga bawal sa ating mga pregnant woman? We have the alcohol, caffeine, and nicotine or smoking. So, smoking during pregnancy lowers the mean birth weight and increases the risk of perinatal mortality. Pag sabihin natin perinatal mortality, before pa na mailabas yung baby, mamamatay yung mother or either or the baby. So smoking seems to affect the conversion of dietary calories into weight gain. And when segments of umbilical cord from the mothers who smoke were studied, large areas are swollen and irregular endothelial cells were found. It is postulated that smoking increases the mother's level of carboxyhemoglobin and nicotine, causing a decrease in the oxygenation of the fetus. Okay. For the excessive maternal alcohol ingestion, it is linked to fetal alcohol syndrome. So, meron tayong tinatawag na fetal alcohol syndrome, which major features nito is CNS disorders, okay? Nagkakaroon ng mental retardation yung bata, growth deficiencies, and facial deformities. Those para yun sa mga patient na excessive yung pagtake nila ng alcohol during pregnancy. And for the caffeine, caffeine crosses the placenta to the fetus very rapidly. So, the drug metabolizing ability of a fetus is extremely limited. So, hindi niya ma-metabolize kasi it's caffeine eh. So, the fetus can metabolize alcohol to a limited extent but not caffeine. Alcohol, caffeine, and nicotine dramatically increases the circulating levels of catecholamine. Okay, so complications of pregnancy. So what are the complications of pregnancy that may be experienced by a mother? So nausea, vomiting, improper weight gain, body weight, toxemia. Pag sabihin natin toxemia, it is a condition which is excretion, it is characterized by excretion of albumin in the urine, and convulsion are its clinical manifestation. So dito sa ating libro may dalawang klase ng or classification ng ating toxemia. We have the acute and the chronic. So included sa ating acute toxemia of pregnancy, which is onset after 24th week of the pregnancy, we have two types, si preeclampsia and eclampsia. Itong preeclampsia is hypertension with proteinuria. Pag sabihin natin proteinuria, increase or presence of protein in the urine and or edema. For eclampsia, so merong convulsions or coma yung ating patient, and usually both when associated with hypertension, proteinuria, and edema. Okay? So, preeclampsia and eclampsia. So, the same lang yan siya, pero yung mga clinical manifestations niya is vary. In which itong eclampsia and preeclampsia or toxemia is the increase of BP, okay, or blood pressure. For the chronic hypertensive vascular disease, meron dalawang klase, without superimposed acute toxemia or with superimposed acute toxemia. So, toxemia, which complicates some 4% to 6% of pregnancy, remains among the leading causes of maternal deaths, prenatal deaths, and low birth weight infants. An unusually high incidence of preeclampsia seems to exist among socio-economically deprived groups. Okay. So, ang kailangan or para ma-manage itong toxemia na to, so optimum nutrition is a fundamental aspect of therapy. Emphasis is laid on HBV protein foods and sources of iron, calcium, and minerals. Salt intake is restricted for edema, while most pregnant women adjust to restricted sodium intake. Some tolerate it poorly. Okay, so developing a healthful diet for pregnant woman. Ano ba yung magagandang diet? So, dito sa atin sa table 52, okay, page 208, makikita dito yung daily food guide for a pregnant or lactating woman. So, nakadivide yung ating pregnant woman and lactating woman. So, we have here dito, the mother or the pregnant woman should take 4 cups of milk, 6 to 8 ounces of a combination of lean meats and cheese, 1 or 2 eggs, 1 or 2 servings of dark or green yellow vegetables, 2 servings of vitamin C rich fruits such as yung oranges, apple, okay, so and so on and so forth, and vegetables. So 4 to 6 servings of other vegetables, fruit, and juices. So mapiyaman mo if ever dahil routine yung pagkain mo ng mga fruits, pwedeng gawin mo na lang fruit shake. Send 10 servings of whole grain and enriched breads and cereals, and drink a lot of fluids and limit salt intake. Bakit nga nililimit yung salt intake? This is to prevent toxemia. Okay, so yun ang ating pregnancy. So that's all for the pregnancy or chapter 9. Now let's go to chapter 10 which talks about naman sa lactation. So ano naman yung ating mga diets, okay, for lactation. So, for lactation, pag from the word lactation or yung mga, kasama pala to sa chapter 9. I'm very sorry, kasama to sa ating chapter 9. Okay, so, sa lactation naman is from the word lactation, yan yung nagpapasuso or nagpapa-breastfed na mga mother. So, lactation is the preparation for assuring an adequate supply of good quality breast milk must begin at the onset of pregnancy. So, from the beginning na pregnant ka, nalaman mong pregnant ka, you need to be careful na, syempre, you think futuristic na mapipikir ka na kailangan na maganda yung nutrition ko kasi after my pregnancy, pakasusunaan sa watakan. Okay? We need to prepare ourselves to assure na merong adequate supply ng gatas para sa inyong baby. So, most of the dietary essentials are increased over and above the requirements during pregnancy to meet the demands of milk production, namely the calories, the proteins, the calcium, the vitamin A, thiamine, riboflavin, niacin, and ascorbic acid. So, yun yung mga ilan sa mga ini-increase natin during pregnancy. Again, calories, proteins, calcium, vitamin A, thiamine, riboflavin, niacin, and ascorbic acid. Okay, so by World Health Organization, breastfeeding is the normal way of providing young infants with the nutrients they need for healthy growth and development. Virtually all mothers can breastfeed, provided they have the accurate information and the support of their family, the healthcare system, and the society at large. Okay, pinaniwalaan or sinabi ni World Health Organization, breastfeeding is the best way, okay, to provide all the nutrients needed by the by the young infant. So, but madami ding exemptions dyan or considerations. Kung yung mother is unhealthy, okay, having unhealthy practices, hindi maganda na nagpapasuso siya. Okay, such as smoker siya or drug addict siya, gitop manip ka-op, okay, na ino-opt natin yung bata in breastfeeding. Pero yung mga healthy ones, okay, na talagang meron namang gatas sa kanilang breast, mas mabuti na yung breast milk compare sa mga nasa commercialized na mga milk na galing sa cow. Okay, so what are the benefits of breastfeeding for your baby? So ano ba yung mga benefits nito? So breast milk provides the ideal nutrition for infants. It is more easily digested than infant formula. That's why ng mga instances tiganan or constipated yung mga bata taking infant formula compare sa mga breastfed na babies. Okay, so breast milk contains antibodies that help your baby fight off viruses and bacteria, which is hindi natin siya makikita sa infant formula. Sa infant formula, mostly nakikita natin is vitamins, minerals, okay, so yun yung main components niya. Pero with the antibodies, hindi nakaka-produce or walang antibodies yung ating infant formula. So the physical closeness, skin-to-skin touching, and eye contact all help your baby bond with you and feel secure. So doon nabubuo yung trust nung ating, kung nasa psychological aspect naman to, doon nabubuo yung trust ng baby sa mother kasi nga they have this kind of bond. Okay, so breast milk is higher in lactose than in cow's milk. The lactic acid converted from lactose limits the growth of disease-producing germs in the GI tract. Okay, so which is nagpapaganda din ng metabolism ng inyong GI tract. Breast milk have no difficulty with the regulation of calcium phosphorus level because it is natural, and bottle feeding affects the dental arc. Okay, kaya nga yung mga bata gilalay dito susup-susudan ang tendency ang nagkakaroon agad at early age nagkakaroon ng dental caries compare sa mga batang breastfed. Okay, so ano naman yung mga benefit ng breastfeeding sa mother? Okay, so breastfeeding burns extra calories, so it can help you lose pregnancy weight faster. So, nakakatulong daw siya mag-burn pa ng extra calories na nag-gain mo during the pregnancy, and nakakatulong siya for loss of pregnancy pregnancy weight. So it releases the hormone oxytocin, which also helps your uterus to return to its pre-pregnancy size and may reduce uterine bleeding after birth. Kaya nga sa EINC or Essential Interpartum Newborn Care natin, is sinasama natin agad-agad yung early initiation of breastfeeding para kasi matulungan natin yung mother to prevent uterine bleeding. So breastfeeding also risks the risk of breast and ovarian cancer. Intimacy between mother and child is also enhanced during pregnancy, and there are no bottles to clean or formula milk to prepare. So, hassle-free siya compare sa atin sa breastfeeding. Pero adman ang mga tendency, hassle sa mga mother yung breastfeeding, ginalagi dito working. So, mother. Okay? So, what are the nutritional requirements for the lactating woman or mga nagpapasuso na mga babae? So, for the calories, additional 1,000 calories to help produce the milk. Okay? For the protein, additional 20 grams to compensate the protein lost in the milk. And then, calcium and phosphorus, so increase in 0.5 milligram to prevent severe depletion of maternal calcium for milk production. And then, iron, additional intake is recommended for blood loss and parturition, for milk, iron, and basal losses. Okay? So, vitamin A, additional 2,000 IU needed in milk secretion. And then, riboflavin and vitamin C and other vitamins such as yung niacin natin, yung nasabi ko kanina, additional allowance is needed for milk secretions. And lastly, fluids or water. 8 glasses of water or more is recommended for lactating women. So, ito yung mga nutritional requirements that are needed for mother or lactating mother. So, if you want to be more in-depth yung discussion, you can read your books on starting page 210 hanggang sa 215. So, mas mababasa nyo doon yung mga nutritional requirements na kailangan for lactating women. So, factors affecting milk secretion. So, what are the factors na nag-affect sa pag-secrete or paglabas ng gatas? First is diet. So, it's intake of meat and vegetable soup. Okay, nagpapaganda siya ng milk secretion such as yung tahong, tulya, malunggay. Lagi dito, di ba? So, mga lokas na kanga sa mga soup, okay, mga sawaw, mga vegetables para mas mapeso ka pliyo o gatas ka. So, milk and fruit juices have been referred to as galactogs or milk secretion stimulating. Okay? So, for the nutritional state of mother, malnutrition and illnesses such as cardiac and kidney diseases, anemia, beriberi, tuberculosis, and infection can lessen the quality and quantity of milk flow. Again, yung mga diseases katulad ng anemia, beriberi, TB, and other infection can lessen. So, bumababa yung content or yung secrete ng gatas. So, emotional and physical state. So, you need to be relaxed in a pleasant surroundings and lots of rest and good sleep. Doon, mas mapropromote mo yung magandang secretion ng gatas. So, isa din is the suckling. Okay, suckling right after delivery stimulate milk secretion. Gilalagay dito, di ba? Kaya nga pag early initiation and then para inom ng bata yung colostrum, gilalagay dito agad-agad nakasak sa'yo yung baby, nagkakaroon ng, nagsistimulate siya ng milk secretion. Okay? So, mga contraceptives and drugs can depress milk. Sa contraceptives naman, kung mga pills, okay, or mga injectables, may naman tayo. May mga contraceptives naman tayo na maganda for breastfeeding woman. That's why you need to be careful na if ever man lang napupunta ka, example, you're a mother, and then, or yung mother pupunta sa'yo at alam mong nagpapasuso, okay, at nagpapasuso siya, kailangan tanungin mo talaga, ma'am, suswa nga wata o di. Kasi hindi pwedeng ibigay sa kanya yung type of contraceptive na combined yung ating progesterone and estrogen. Kailangan na ang binibigay lang natin yung isang pill lang, okay, one pill or one hormone pill that is good for para hindi natin malesen yung kanyang milk production and milk secretion. Okay? So, process of milk production. So, during conception hanggang sa 16 to 22 weeks, okay, nag-i-increase yung hormonal control natin in which it is the endocrine. Okay? So, yung progesterone natin nagpipik o tumataas yan siya. And then, afterwards, after birth, bumababa yan siya. Okay? By the autocrine local control. So, 30 to 48 hours, medyo mababa na siya. And then, tsaka naman siya tataas pag medyo tataas na siya pag nasa aabot na siya. And then, magsa-stop siya by 6 months. Ginagawa na 6 months, kaya nga 'di ba advised sa mga bata na after 6 months, pwede na tayong magbigay ng supplementary feeding kasi hindi na lahat ng breast milk na galing sa mother, kung yun lang talaga yung nasususo or nakakain ng bata, it cannot suffice. Kasi tapos na yung gestation or yung period na kung saan mas malaki yung nutrition na nakukuha ng bata. Okay? So, the control of lactation. So, the baby sucks from the breast, which is, example, the baby, nagsuck na siya. So, nagsisend ng signal niyan siya sa hypothalamus. So, ang ating posterior anterior pituitary gland, okay, anterior pituitary gland nagre-release ng prolactin para sa milk production. And then, the posterior pituitary gland natin, nag-release naman ng oxytocin para sa milk release. Again, magkaiba po yung milk production and milk release. Sabayan yan siya pag nagsuck na. So, kailangan nag-stimulate siya ng milk production and at the same time mag-stimulate na for milk secretion. Okay? So, pag full breast yung ating pag golden rule of milk production, pag full na yung breast, nagsuslow yung milk production kasi nga punong-puno na. Pero pag empty na yan siya, magpapabilis yung milk production. So, katulad lang din, ginalagay dito punong-puno ka na, lagi doon, di ba, parang you're sleepy, ganyan. Because you need, pag gutom ka, okay, kailangan mong mabilisan na kumain-kain kasi you need to digest food kasi gutom ka. Okay, so, meron tayong tatawag na colostrum in which itong colostrum na to, ito yung nakukuha ng bata immediately after delivery pag nagsuck na yung bata sa breast ng mother. So, it is the ideal food for the first few days of life. It is a thick, yellow, or sometimes clear na secretion out of the breast. It is rich with antibodies and WBC that can defend against harmful bacteria and viruses and even stimulates the production of antibodies in the newborn's own immune system. That's why miyak ka pepya, pag ang paganay yung first na milk secreted in the breast of the mother is mapunta sa bunganga ng bata because that is colostrum. So, meron tayong tinatawag na letdown reflex which allows the milk to flow. Itong reflex na to, ina-allow natin na mag-flow yung gatas. So, it occurs when the baby sucks, okay, prompting the release of the hormone oxytocin which in turn stimulates the flow of the milk. Again, oxytocin, hormone siya na nakakatulong sa uterine contraction and also nakakatulong sa milk secretion or pag-release ng gatas. Yung ating prolactin para naman sa milk production. So, what are the composition of the milk? So, we have the foremilk and the hindmilk. Foremilk is the first milk to flow when the baby starts suckling. The milk has been dubbed as the thirst quencher because it is diluted and low in fat. Again, thirst quencher. So, pag sabihin natin kasing thirst quencher is nawawalan ka ng uhaw. Yun daw yung gatas. It is yung foremilk. Yung hindmilk naman, it is milk that is high in protein and fats or calories. Yun yung dalawang composition ng ating milk. So, may kita niyo yung foremilk, medyo lighter siya compare sa ating hindmilk. Okay, so now let's discuss the different breastfeeding positions. Okay, again, di ba, yung mga nakakatulong din sa pag-secrete ng milk is the breastfeeding position. Okay? Importante na informed or matao. Okay? May enough knowledge yung ating mother sa mga different positions na to para ma-encourage yung magandang breastfeeding nung bata. Okay. So, we have first the cradle hold. Okay. Ito yung nasa picture. This is the cradle hold. The cradle hold often work well for full-term babies who were delivered vaginally. Women who have had a cesarean section may find it difficult because it puts too much pressure on the abdomen. So, ganyan nakahawak. Yung normal na hawak sa baby, okay, yun ang cradle hold, okay? Next is the football hold or clutch hold. Parang nakahawak ka ng football or clutch bag. So this position is useful when you've had a cesarean and you want to avoid placing your baby against your abdomen. Kasi 'di ba, sa cesarean nag-cut open ka ng abdomen. So if you don't want to put pressure on the wound, so maganda din to na position. So hindi gia position na naba nakabitay kakaptan mambo bibigyan din ng position. So pwedeng place a pillow on your side and then i-cradle mo or i-clutch mo or football hold yung baby. Okay? So, meron tayong crossover hold. So, the mother who had cesarean, okay, which is to avoid contact, having the baby rest on your shoulder. So, nangyari is crossover. Okay, papantag ka. And then, ikaw, sinistimulate mo yung breast mo. Hinahawakan mo yan siya. So, the baby is small and has a trouble latching on. So, the hold allows you to guide her head and your nipple. So, hawakan mo. Nakita nyo dito, hahawakan yung ulo ng baby and then hawakan mo yung breast. And then, you need to guide your nipple para mahanap niya. It works well for women who have large breast or flat nipples. Again, it works well for women who have large breast or flat yung kanyang nipples. Hindi flat yung breast, flat yung nipples. Okay? Para mas kilaing ka, mas kidpo-dpong ka so nipples o mother. Okay, for the side-lying position, this position is a good choice when you're nursing in the middle of night or when you need some rest. Okay, side-lying. Make sure nga lang, di ba, nakita nyo, meron siyang placed pillow dito and then medyo naka-side yung baby, hindi siya naka-flat. Kasi pwedeng, pag naka-flat yung baby, pwedeng magkaroon ng aspiration. Okay, so what a good latch looks like. So, ito yung magandang latch. Gilalay dito, nakita nyo yung chin touches the areola and then half of the areola is hindi masyadong makita kasi nakasak yung baby and then yung ilong niya dito sa taas banda. Okay, so may touch ng head, yung chin niya and yung kanyang nose. Dito sa atin sa false position, nga makaawats kanya nun. So, this type of latch, okay, hindi masyadong maganda or hindi malaki yung nakakatch na gatas nung bata. So, ang tendency di sayapan kusog. So, watas. You need to make sure na good latching yung baby para enough yung gatas na naiinom ng baby. So, you should not breastfeed if okay, these are the following na hindi dapat nagbe-breastfeed if the mother is HIV positive. Pag HIV positive yung mother, hindi pwedeng mag-breastfeed. If you have an active and untreated, okay, active and untreated. Pag sabihin, ma'am, what if nagkaroon siya ng tuberculosis at treated na siya? Okay lang. Pero pag active at hindi ka pa nagagamot, so hindi pwedeng mag-breastfeed. So receiving chemotherapy for cancer, using illegal drugs such as cocaine or marijuana or even kung ano man shabu yan. So if you're taking certain prescription medications such as drugs for migraine headaches, Parkinson's disease or arthritis, hindi ka pwedeng mag-breastfeed. And then your baby has a rare condition called galactosemia. Okay, in which yung galactosemia, hindi niya metabolize yung galactose na nakukuha sa milk. That's why hindi pwede. Kasi increase yung kanyang galactose, mas pag magpa-breastfeed ka pa, mas further mag-increase. So, madaming effect naman mangyayari and then which may lead to mental problems ng bata. So, and cannot tolerate natural sugar called galactose in breast milk. Okay, so what are the top 10 foods for lactation? So, we have papaya, spinach, salmon, carrot juice, hummus. Okay, di ba kita hummus na parang roti, somewhat ganun. Oatmeal, asparagus, apricot, water, and brown rice. Okay, so ito yung top 10 na maganda for lactating women. So what you eat now can have a positive effect on nursing babies' future eating habits. Okay? So, again, nakasalalay sa atin yung magandang nutrition ng bata. So, from the start pa lang ng conception mo, pag maganda na yung nutrition mo and naging well-developed ang baby until magkakaroon ng effect siya for the lactation. So, check. We have the check. It means tama, sapat, eksklusibo ang pagpapasuso kahit nasa trabaho. So, breastfeeding and work, let's make it work. Okay? So, ano mga padkasayap kerasay or ano to? ayaw nila na napapasuso or nahihirapan silang magpapasuso. So with this, tong programa to ng DOH, inayanhayaan kumaga yung at ini-encourage natin yung mga iba't ibang companies or any agencies na magbigay naman ng breastfeeding room sa mga mother na nagpapalactating or nagpapasuso. So, sa mga mother naman na at work na hindi kaya nga na magpasuso, so we have different breast pump. Okay, so itong breast pump na to nakakatulong naman din para may reserve yung bata. Ginalay dito paggawaan ka, pag work ka. Okay, so yan. So we have the manual. Ikaw mismo yung ito yung handle mo and then yan, pinupush mo yan siya. And we have also the electric breast pump. Okay. So, yan yung pwede. And then, ito, meron tayong tinatawag na mga plastic na nilalagay natin sa freezer. Okay? Hindi natin siya nilalagay sa body of the ref. Ilalagay natin siya sa freezer. And then, pag ilalabas na yan siya, tsaka natin siya iwa-warm and then ipapagata sa baby. So, storage. Ito yung breast milk storage duration. For, pag nasa countertop or the room temperature is less than 78 degrees Fahrenheit or 26 degrees Celsius. So, ang duration lang nun is nasa 6 to 8 hours. So, recommended, it is stored in a covered container and attempt to keep the milk as cool as possible. So, for insulated cooler bag, ito yung sinasabi kong insulated cooler bag, this one. Okay. So, pag nakalagay dyan and nasa less than 40 degrees Fahrenheit or 4 degrees Celsius, pwedeng kaya yan siya nasa 24 hours. So, keep the ice packs in contact with milk containers at all times and limit opening the cooler bag. Pag nasa body ng ref siya, okay, or nasa refrigerator siya sa loob ng ref, so umaabot ng 5 to 5 days. So write the date in each container and store milk in the back of the fridge, okay, where temperature are cooler. So pinakadulo yan siya sa likod or pag nasa freezer naman or section inside the fridge, okay, less than negative 15 degrees Celsius, aabot ng 2 weeks pa. So mas kung nasa cool environment talaga yung breast milk mo nakadagay doon, mas matagal siya maglalast. So, temperatures vary more in a style of refrigerator with one door and which provides a section inside a refrigerator for freezing. As a result, breast milk lasts less time. Do not refreeze, okay? Hindi pwede tayong mag-refreeze pag nilabas mo and then, no. You need to discard yung mga nailabas mo na. Okay? So, freezer with its own door. Okay? Example, isang breath lang talaga na freezer lang siya. So, it may last ang kanyang temperature nasa 0 degrees Fahrenheit or nasa less than, negative 18 degrees Celsius. So, maabot ng 3 to 6 months. So, store milk towards back of the freezer where temperature is most constant. Milk stored for longer periods in the range up to 6 months are still safe, but some of the lipids in milk undergo degradation, resulting in lower quality. Again, do not refreeze once tinanggal niyo siya sa freezer. And for the deep freezer in which meron siyang negative 4 degrees Fahrenheit or negative 20 degrees Celsius na temperature, umaabot ng 6 to 12 months. So, the milk stored for longer periods in the range up to 12 months are still safe, but some of the lipids in milk undergo degradation and result in lower quality. Okay? So, do not again refreeze. In warming breast milk, okay, warm the bottles under the warm running water or place them in a container of warm water or in a bottle warmer. Or crack pots are dangerous and exceed safe temperature. So, example, mayawaig tagun kaon nga pa kayon. So, temperature should not exceed 98.6 degrees Fahrenheit. So, excessive heat destroys the infection-fighting properties of milk. So, that's why hindi masyadong mainit. Or, example, may kayo ka sa mayawaig na nasa boiling point siya and then inudod ko, hindi ka pa kayo to. So, never microwave milk. It creates hot spots which may burn infant. And some babies will drink milk that hasn't been warm. Okay? So, kapaya, in room temperature, painumin mo. Kasi man ng mga bata, hindi umiinom ng mainit. So, yan. Yung mailan sa pamamaraan, paano ba pa-warm ang ating breast milk. Okay? So, breastfeeding, it rocks. Okay? So, now, let's talk about the chapter 10. So, pamasok tayo sa pag-discuss ng ating chapter 10 or infancy. Okay, para at least 2 chapter yung na-discuss natin with regards sa ating nutrition and nutrition tayo. Okay, sa page 241, dun magsa-start ang discussion. Sa ating libro, dun magsa-start ang discussion ng ating infancy. 241. Okay. Childhood to. Wait lang. Hindi pala. Nasa 219. I'm sorry. Page 219. Okay. So infancy, or the term infant refers to a person not more than 12 months of age. Again, yung term na infant, okay? Infant, it refers to a person na hindi umabot or hindi lumagpas sa age ng 12 months or 1 year. An infant, a healthy full-term infant weighs about 2.6 to 2.7 to 3.2 kilogram, or nasa 6 to 7 pounds, and measures 48 to 50 centimeter or 19 to 20 inches in length. His or her head circumference averages 35 centimeter or 14 inches, and his or her skin is moist, elastic, and not wrinkled. So an infant's birth weight doubles in the first 4 to 6 months of life and triples within the first year. So yun yung pag-increase. Okay? Again, ang normal na full-term na baby is nagwe-weigh sa 2.7 to 3.2 kilogram, or nasa 6 to 7 pounds. And yung kanyang laki in length is 19 to 20 inches or 48 to 50. Yung kanyang head circumference umaabot ng 35 centimeter or 14 inches. Okay, so what are the methods of feeding the infant? So we have the breastfeeding, we have the artificial feeding, and mixed feeding. Pag sabihin natin breastfeeding, yun na nga, yung pagpapasuso sa baby. Artificial feeding, ito yung bottle feeding using infant formula. And mixed feeding is the combination of the breast milk and the bottle feeding. Okay. So what are the nutritional requirements for an infant? Okay, for a child, for an infant or a baby. So, infants under age 6 months need an average of 108 calorie per kilogram of body weight to supply them with adequate energy. So, example lang natin, again, di ba, 108 per calorie of per kilogram. Okay, 108 calorie per kilogram. So, example lang natin, yung kilogram ng bata is nasa 2.9. So, ang kailangan niyang calorie per day, okay, is nasa 313 calories ang tinetake niya. This is important to supply them with adequate energy. So 6 to 12 months umabot ng 98 per kilogram, 98 calories per kilogram. And for protein naman, so sa protein naman, pag 0 to 6 months, 2.2 grams per kilogram. So example, sabi ko nga yung 2.9, tapos ita-times mo siya sa 2.2 na grams. Ang protein intake ng bata sa ganung weight is nasa 6.38 protein. Okay? Or 6.8 grams of protein. For 6 to 12 months, nasa 1.6 gram per kilogram. For fat, for infants up to age 2, at least 40% of calories consumed should be from fat. Okay? So, carbohydrates, an allowance of 1/10 1/10 ounce or 10 ounce per pound of the body weight equals 1 ounce per 10 ounce of milk is prescribed, which also equals 1% of the body weight. For minerals, all minerals and vitamins are required in proportionately greater amounts compared with the needs of the adult. The American Academy of Pediatrics recommends the formula-fed infants be given formula with iron fortification from birth. Okay? For vitamins, vitamin K is routinely given by injection. Diba? Remember, yung pagbigay natin ng vitamin K sa mga bata after delivery or after silang pinanganak, okay? To stimulate yung kanilang clotting factor. So, to all infants at birth, to supply vitamin until the infant's intestinal tract can synthesize on its own. And vitamin D is recommended for some breast milk-fed infants. Okay, so fluoride supplementation is recommended for infants aged 6 months to 1 year unless their food is prepared with fluorinated water. For water, daily fluid needs of water are approximately 2.5 ounces per pound of the body weight. So, hindi masyadong increased yung kanya. Tamang-tama lang, nasa average. Di man kapaya, sobra-sobra yung pinapainom nating tubig sa bata. Question, may nagtatanong na girakuan na pwede ba na bigyan ng tubig yung mga bata? Yes. Mga infant, yes, pwede po talagang bigyan ng tubig. So, in terms na hindi pa busog sa breast milk and bottle fed, pwedeng bigyan siya ng tubig. Okay? So, infant typically consumes enough breast milk or formula to supply this amount. During period of illness or diarrhea, vomiting, fever, or exposure to sun, needs additional fluids. Tira na, dingguguan na, di nyo pa inom masaig. No, mas kailangan po ng bata na uminom ng additional fluids para ma-prevent yung dehydration. Okay? So, feeding time for infants. So, 2.5 to, pag nasa 2.5 to 2.7 kilogram baby, they are usually fed every 3 hours. So, every 3 hours, kailangan na papasuso mo siya or napapainom mo siya. So, 3.6 to 4 kilogram na baby naman usually feds every 4 hours. So, at 2 months old, the baby sleeps through the night and night after 10 p.m. feeding. So, between 2 to 3 months old, the baby is on 4 to 5 feeding schedules. So, every now and then, nasa schedule mo yan siya na pasuson ka time by time. Okay? So, ito yung mga pwedeng ibigay na diet or supplementary feeding sa ating bata after pag umabot. Kasi, ideally, add na mga books sa din yan dito ron, or ideally talaga na by 4 months, nagbibigay na tayo ng supplementary feeding sa bata. Pero dito sa atin, it is practice na nasa 6 months pa. Kasi may mga bata na nahihirapan mag-metabolize ng solid foods at the age of 4 months. So, by 4 months, okay, type of food na pwedeng ibigay sa bata is scrapped banana or papaya or thin lugaw or commercial cereal pop like Cerelac. Pwede na siyang bigyan. Rationally, it is less likely than wheat to cause an allergic reaction. For 5 to 6 months, pwede na siyang bigyan ng strained vegetables, crackers, biscuits are given not only to soothe the sensitive gums but also to teach the baby the art of self-feeding. So it offers offer vegetable first because they may be more readily accepted. So magbigay tayo muna ng vegetables kasi mas mabilis silang ma-accept and then wala masyadong allergic reactions. For 7 to 8 months, foods are chopped finely and not strained to teach mastication. We can give cheese, yogurt, rice, noodles, and pudding. So it provides important source of iron and add variety to the diet. For 9 to 12 months, whole tender foods and foods chopped coarsely are also may given. So, pwedeng pag medyo malalaki na yung chop niya, pwede nang ibigay. So, chop or mashed according to infant's ability to chew. So, pwede siyang namang gawing chopped or mashed pag hindi naman kaya nung bata mag-chew ng food. So, how to give supplementary foods? First is introduce food one at a time. Okay, nabalango na. Okay, no. One at a time. One food at a time. Give small amount of foods. Hindi pwede masyadong pangmalakihan yan siya. Use thin and soft consistency. Gradually modify the consistency. Okay, medyo munang pino. Okay, soft yan siya para madaling ma-digest ng baby, hindi siya mabigla, and then i-modify mo naman siya. Next. So, never force an infant to eat more of a food that he can't take. Pag hindi niya na kaya or ayaw niyang kainin, never force na bubuka mo yung bunganga niya and then papakain mo sa kanya. No. Omit the food if the infant refuses to eat several times. Kaya lito yung bata, ayaw niyang kainin yung isang vegetables. So, for example, papaya, ayaw niya talagang kainin, omit mo na, tanggalin mo na siya. So, slightly seasoned, small amount of salt and variety of foods is very important. Kasi, malbudmas mo suwata. So, kailangan na-introduce natin siya na sa iba't ibang type of food. Okay? So, I think that ends my discussion for the chapter 9 and chapter 10. Okay? If you have questions, clarifications, you can read your books. Okay? Kasi dito, sa libro, may kita mo talaga yung dito mababasa mo yung simple tips on how to help the infant eat better, okay, the methods of formula preparation, either aseptic method or terminal method, which is hindi ko nasama sa PowerPoint presentation, but still you need to study about it, okay? So, dito sa libro, mababasa nyo yan siya, and then the supplementary foods na by month, okay, diniscuss talaga, kasi dito is more on iniisa nga. And then, tips of giving new foods, ano yung magaganda, and then what can be the easy to prepare baby foods. Andito sa table 53, page 229, may kita dito yung mga foods na masyadong mabilis na pwedeng ibigay sa baby na i-prepare natin. Okay? So before ko i-end ang discussion, meron dito the common disorders na kukuha ng or na-experience ng mga bata. So common disorders includes in infants, okay, includes diarrhea, allergy, vomiting, constipation, and colic are disorders that affect nutritional status of the infant. When such conditions arise, it determines, you need to determine the underlying cause. Baka pwedeng cause ng overfeeding or underfeeding, bacterial infections, or unsuitable food. So, you need to maintain water and an electrolyte balance. That's why, yakadadala misunderstood ng mga mother tanose sa mga kanagila lagi dito di magudua sa wata na dingan pa asuson, dingan pa kainom sa ganito kanyang kasi no. Okay? Pag hindi siya cause ng overfeeding or underfeeding, tsaka mo pag alam mo na yung underlying cause ng nagkuan. Pero pag hindi, you need to feed kasi kailangan ma-maintain yung electrolyte and water balance and modify milk formula to suit the digestive capacity. So first, let's talk about the diarrhea. Diarrhea is the most frequently caused by bacteria and viruses. Although both overfeeding and underfeeding can also cause diarrhea, cow's milk causes allergy to some infants, leading to diarrhea. So rice water suffices for mild diarrhea, but in case of dehydration, parenteral and or oral fluids should be given, such as SI Oralite, okay? A locally developed oral rehydrating therapy or Orisol, a premixed oral rehydration powder available in government health institution. So in acute diarrhea, food can be given as early as 8 hours after the beginning of rehydration. Breastfeeding should be maintained with only a few hours interruption during early phases of therapy. As stool volume decreases, food rich in protein are generally added like banana, lakatan, or latundan, and guava. So another disorder is vomiting. Vomiting is commonly seen in infants during the first few days. As in diarrhea, special attention must be given to fluid replacement. So katulad sa pagkapagudu, kailangan mabugira dito dinggo sa wata na fluid replacement. Then, other modifications may include reducing the number of feedings kasi baka na overfed yung bata kaya suka ng suka, acidifying milk, or making it a point to burp and the infant every after feeding. Okay. So, allergy, eczema is the most common sign of allergy in infants before 9 months of age. When protein of milk is the offending ingredient, it is referred to as the milk allergy. And lactose intolerance, the enzyme that hydrolyzes the carbohydrate lactose in milk into glucose and galactose is present, increasing the gut fluid volume. Bacteria in colon ferment the lactose, and a variety of gastrointestinal symptoms occur with varying severity. We have also constipation or infrequent bowel movements are not really the problem in infants, but the pain on the passage of stools and the inability to complete a movement through the urge is strong blood in the stools and involuntary soiling of clothes between movements. To overcome constipation, the following measures may be taken. So, pwedeng moderately restrict milk intake, increase fruit, vegetable, and fluid intake, change sugar in the formula to laxative brown sugar, and check the reconstitution of milk formula. And lastly, na common disorder, we have the colic. Okay, so colic is an acute paroxysm pain fussing, crying, and irritability, which last for 4 months. Causes are psychologic factors, maternal and family tensions, gastrointestinal hypermotility, and functional immaturity of central nervous system and GI tract. So changing of the formula may bring about some improvement but not in most cases. So physical measures such as providing a cozy warm environment, placing the baby prone on hot water bottle or a drink of warm water may at times subdue paroxysm of crying. Colic is parang to mapapano-pano ang duat yan and then sakit-sakit at yan and then iyak ng iyak yung bata. Okay? It is common sa infants. So, dito din sa book, mababasa natin yung indications of good nutrition ng isang infant. So, a steady weight gain of 150 to 250 grams per week that slows down towards the end of the first year is about first year to about 120 grams per week is considered as the proper weight gain. So, remember, nagdo-double yung weight at the end of 5 months and triple at the end of 1 year. So, the baby length increases about 25.4 centimeter or 40% more at the end of the first year. For the behavioral development ng isang bata, 0 to 1 month suckles and smile, 2 to 3 months vocalizes and controls head, 4 to 5 months control hand and rolls over, 6 to 7 months sits briefly and crawls, 8 to 9 months grasps and pulls up, 10 to 11 months walks with support and stands alone, and 12 months can start to walk alone. Okay? So, alhamdulillah, final na to. Ito na that sums up my discussion for chapter 10. Again, if you have questions, clarifications, please do read your book. It is all placed or all discussed in your books. So, inshallah, next meeting, i-discuss ko yung childhood and then ipopost ko na rin yung ating reporting para mag-start, para maka-prepare na din kayo. Okay, so thank you for watching this video and wassalam.